Hi, folks. This is Dr. Rex Gatto, business psychologist and cognitive behavioral psychotherapist. I completed a series of new webinars for nurses and physicians to help address the stress of the jobs that you do day in, day out. The webinars are for all medical providers, but in general, especially those people working in ICU and COVID floors. This webinar, dealing with loss, is to help and support through the stressful times that we lose patients. There is no one right way to deal with loss, especially as a medical provider. And in this webinar, I will share with you some of my thoughts on how to become resilient, to continue the tremendous work that you do with patients on a day-to-day basis. I'd like to begin with strategies in dealing with loss. And please note again, there is no one right way to deal with grief. But here are some things for you to think about. One is to acknowledge the pain that you are feeling. It's part of the human process, a part of our emotions and how we are wired as human beings to grieve and to feel pain. Accept the grief that you are feeling. Don't try and push against it and think I shouldn't feel this way. Don't. Accept it. One of the things we know about grief is that it also creates unexpected emotions within us. Understand the process that you are going through. It's your experience. It's how you are dealing with the loss of a patient and dealing in very difficult situations today with the pandemic, COVID, and many of the other stressors that medical people take on a day-to-day basis. Seek out support from other caregivers. I'm going to give you some techniques, ways to really express the unexpressed emotions that you may be feeling, and make sure that you are a caregiver for yourself and a caregiver for others. I also did a prior webinar, Support, Positive Thinking for Nurses and Physicians. You may want to look at that as a help as well. So accept the feelings that you have and understand that grief in your own way, and no one can tell you, don't feel that way. Dealing with the loss of a patient, there are things that you probably know, such as keeping a journal, expressing the unexpressed. To me, that's very important. Years ago, when I wrote a book on stress, one of the main points was always to have someone express the unexpressed. Don't keep it bottled up. Give yourself permission to feel the way that you are feeling. Remember that you are not a physician. Many people think you're a nurse, you're a physician, you're an APP, a PA, clinical nurse practitioner. It's not true. We're not labels. We are human beings. And there is a position that you fill, but you are much more than that position. When we talk about reframing, reframing is another way to think about a situation. Keep expanding your thoughts. It's not about just looking at it and changing, but expanding your thoughts to look at it in a new and different way. And by doing that, it can change the meaning. Reframing is a way to rethink. And in those quiet moments when you're looking out the door or when you are alone, to really understand the relationship that you're going through with yourself and expand your own thinking and realize that there are ways in which you can expand that thinking and reframe your ideas and thoughts. To reframe your thinking, first, relax. You can't do this and be totally upset and stressed. Calm yourself so that we can look at things rationally. I also would like that you write about the situation and what's upsetting you. It seems that there's a relationship between writing your thoughts, getting them up and out of your mind, and a way to lessen, not eradicate, but lessen. To talk about your mood and find ways to support yourself, looking at the past and the present, but more importantly, looking toward the future, best worst case scenarios and outcomes and positive actions. And here's a format that you can use: the situation, cause, outcome, and positive actions. Situation: describe in detail, what's going on. However your thoughts are, positive or negative, just describe it. And then what you feel is actually causing your stress, and how do you feel? Describe your mood. An outcome: what's the best or worst outcomes for you? And look at both. Don't just focus on all of these bad things that are going to happen. And then positive actions that you are committed to. Please note I wrote I will, meaning you are committed to taking action. The 3 C's: commitment, control, and challenge. What is your commitment? What is the commitment of you to be the best version of you? Are you committed to making sure that you are satisfied and happy? Are you committed to drive toward a positive work and life? Control: what's in your control and what is not in your control? You cannot control the past. You could control your future. Reflect on that. How might you control your future? And realistically, how can you challenge the situation in which you find yourself, or the restraints in which you find yourself? So commitment, control, and challenge. 3 words that may factor very much into your understanding of loss. Another suggested idea: write a letter to the person who passed, to the patient that you lost, and tell that person what you would like to say and how you feel. And do it in a way that it helps you heal. Would you like to share in that letter all the thoughts that you have, and then share it with a trusted friend or peer? And keep the letter as long as you feel it is important and that you draw comfort from it. There will come a day when you will be able to say, I now can let this go. And you can let the letter go. As you let the letter go, let your emotions go. Understand that you did the very best that you could for the patient. You cannot use today's thinking to evaluate yesterday's actions, meaning we learn every day and we do make mistakes. One of the philosophies in psychology is that we are flawed human beings. We do make mistakes, except, yes, you may have made a mistake, but we can move on from that and we can help ourselves to grow and to learn. One of the points of control in the future is that you will learn and be able to better serve people that you care for. Resilience is an important word, not recovery, but resilience. Look at your abilities and rethink and how you can overcome. Stay balanced and positive thoughts, not negative thoughts about the outcomes. We take a look at personality characteristics. Every personality has positive attributes and negative attributes. And sometimes under great stress, those negative attributes can come out, such as being a nitpicker, or focusing on doom and gloom, or being irritated and angry. Those are possibilities of a very stressed personality, but create characteristics that help you to be more in line with how you feel, to be happy and to focus on what you might do in the future. Ways to be resilient: build and maintain close relationships with the people and the colleagues that you work with and family members. Build relationships that are strong, and you can turn to those relationships 2 ways. You can ask for help and you can provide help to others. Keep things balanced. Keep things focused in a positive way. The key to anyone in terms of their own capacity, you can achieve resilience if you have a positive view of how you want to focus yourself, your abilities, your actions, your behaviors, the quality of life that you want. It begins with a positive thought. Now, this does not mean that bad things will not occur or that you won't have to discuss things that are very upsetting to you. It does not mean that. But give yourself credit for all the good things that you do. Don't minimize your good and magnify the bad. Keep things in perspective and explain the present situation in positive terms and look for the future in positive terms. Ladies and gentlemen, here are two resources for you to help you to deal with reframing, rethinking. I did this rather than focusing on grief and talking about death and dying. Reframe your thinking in positive terms and how you can better help the people you will be caring for in the future. If I can be of service to you, if you look on the left side, you'll notice there is my contact information. Please do not hesitate to contact me if you have a question. And I would suggest to you, the cycle of life, we all understand it. Care for yourself and focus on your future in very positive terms.